forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone. Today we are here again to talk about another educational program of Imam Reza Hospital with my valuable and honorable guest, Dr. Fariba Eslamian, a member of the Physical Medicine and Rehabilitation Department of Tabriz University of Medical Sciences. Hello dear Dr. Eslamian, I'm happy that you're here today. Could you please briefly introduce yourself and your department?
Hello, thank you. I'm Dr. Fariba Eslamian, Associate Professor of Physical Medicine and Rehabilitation. I've been working in this department since 2005. And that's my honor to contribute in this international educational program. Let us to introduce our field and our department at first. Physical medicine rehabilitation is the branch of medicine emphasizing in prevention, treatment, and diagnosis of disorders that may produce impairment, temporary impairment, or permanent impairment. American Board of Medical Specialties approved the PM&R as one of the 24 medical specialties in 1947 after Second World War because of severe disability after World War II. This department was established by Dr. Sadiq Mostofi in 1994 and first residential educational stage was started that time, in 1994. At present, there are 9 academic staff members consisting of 3 professors, 2 associate professors, and 4 assistant professors in Physical Medicine Rehabilitation Department of Tabriz University of Medical Sciences.
Great. I was myself really interested about the year that this field was introduced to the world. Now let's talk about your educational program. What's the subject of the program? And please talk briefly about it at first.
Yes, the first training course which we want to educate is electrodiagnosis. During a 8 to 12 weeks period, we will provide an overview of what will be covered in this field, in this course, and what you can expect to gain from taking it.
I'm just asking for myself and also the audience, what is the electrodiagnosis used for?
Electrodiagnostic testing records and measures electrical activity which are produced by muscles and nerves in your body. And it is used to determine if you have an injury related to nerve or muscle function or not. The test is used to help detect neuromuscular abnormalities. There are two primary types of electrodiagnostic tests: electromyography and nerve conduction studies.
Okay, thank you very much. And electrodiagnosis is related to which specialties? I mean, who may benefit from your course, and who is the best target audience for your course?
Okay, electrodiagnosis is a medical subspecialty of neurology, clinical neurophysiology, and physical medicine rehabilitation. In the United States, neurologists receive training in electrodiagnosis after graduation as neuromuscular fellowship or clinical neurophysiology fellowship. But in Iran as well as USA, physical medicine rehabilitation physicians receive their training in electrodiagnosis during residency, not after graduation. So, this course for neurologists and physiatrists and residents of neurology and physical medicine rehabilitation residents could be beneficial.
Thank you very much. Okay, and now if we want to talk a little bit in detail, what are the objectives of your course?
Yes, the students will be able to perform routine nerve conduction studies and special nerve conduction studies. Routine nerve conduction studies such as median, tibial, peroneal nerve conduction studies. And special nerve such as phrenic nerve, diaphragm muscle, anal, paraspinal, and etc. Students will be able to perform after approximately 3 months to perform needle EMG. Needle EMG is performed using multiple needles through the skin into the body and record the muscle activity. The students will be able to perform routine needle EMG as well as special needle EMG. Special such as paraspinal, diaphragm, tongue, and facial muscle, etc. Other objectives. Students will be able to perform EMG and NCS upon the children, which is a challenging case. In children, electrodiagnosis after 3 or 4 months, but routine. Special nerves in the children are a challenging case. Correctly and independently. There are our objectives after this course education.
Okay, thank you very much for your description about the course. And which diseases are diagnosed by these procedures?
Yes, these procedures are used for evaluation of various neuromuscular disorders. Anterior horn cell disease such as SMA, poliomyelitis, sequelae of poliomyelitis since childhood, spinal nerve root disorders, mainly cervical and lumbar radiculopathies, peripheral nerve disorders, mainly acquired neuropathies such as Guillain-Barré syndrome, hereditary neuropathies such as Charcot-Marie-Tooth neuropathy, diabetic and nutritional neuropathy, etc. Neuromuscular junction disorders using RNS for diagnosis of botulism, myasthenia gravis, LEMS, and etc. Muscle disorders, acquired myopathies such as polymyositis, dermatomyositis, hereditary myopathies such as Duchenne muscular dystrophy, Becker muscular dystrophy, congenital myopathy, and so on.
Great, so it's used for a wide range of diseases. It's really interesting. And what are the other educational facilities in this regard?
Also, we perform EMG NCS in both in inpatient setting and in outpatient setting. Some patients referred from hospitalized wards for diagnosis of neuropathy, the cause of paraplegia, quadriplegia, the cause of weakness referred to our department, and EMG NCS are performed upon them. For rule out of GBS, Aman variant of GBS, and etc. As you see in the picture, EMG was being performed upon ICU patients. ICU patient during COVID pandemic for evaluation of critical illness neuropathy, critical illness myopathy, and cause of weakness, so on. Other educational facilities in this regard are including application of central nervous system electrodiagnostic exam, including visual evoked potential, somatosensory evoked potential, and auditory brainstem response. Previously named as triple visual, SEP and ABR, triple electrodiagnosis for central nervous system, for evaluation of demyelinating disorders such as multiple sclerosis, hearing disorders in adult and pediatric patients, myelopathy and spinal cord lesions, etc.
It's really great. I want to know just about your colleagues and your team. Is there anybody collaborating with you in this educational program?
This course's length is approximately 8 to 12 weeks period and divided into the following educational sections. Some items are presented by me and my colleagues, including nerve conduction study, needle electromyography, EDX in myopathies, in motor neuron disease, radiculopathies, neuromuscular junction disorders, in pediatric cranial neuropathy, facial neuropathy, brachial plexopathy, metabolic, and etc. are divided the following section as I said. Students will be expected to spend 6 to 8 hours per week on coursework. We will explore this concept in depth and show how they relate to the topic. Our team are including I and my colleagues, Dr. Salek Zamani, Dr. Hamid Far, Dr. Raha Markazi, and Dr. Tubchizadeh, for education and training, the electrodiagnosis course, and we hope this course will be beneficial for neurology residents and specialists, as well as physical medicine rehabilitation physicians.
Thank you very much. I hope so too. Thank you everybody for watching us. If you have any other information or if you have any question regarding this program, you can contact our team at the website or by email address. Thank you very much.